Now let's talk about mild cognitive impairment, or MCI. It is something that you'll likely hear about if you work with people who are older, and it's also something that I feel like it's important for all of us to know about so that we can take steps to avoid it. So mild cognitive impairment, or MCI, is a specific diagnosis. It's different from dementia, and it is when you have an awareness that there's something changed for you cognitively, and that the cognitive issues, they go beyond what is expected for normal aging. They're mild, and it does not necessarily progress to a dementia, but it could, but it can also progress, or not progress so much, but it can be reversed back to kind of normal aging. So some risk factors for MCI, they are the same as for Alzheimer's disease. Increased age makes it more, puts you more at risk. Having significant health issues like diabetes, high blood pressure, and high cholesterol, anything that impacts the heart, impacts the brain. Depression, drinking a lot of alcohol, a lack of exercise, stress, sleep issues, and carrying the APOE gene. However, there are some risk protective factors for MCI. Some things that, well, you can't always do all of them. So being younger, you can't do anything about that, but being younger is protective. Doing cognitively stimulating activities, that's something that everyone can do. Lifelong exercise, but fear not, if you haven't exercised all your life, you can start now. Start safely, start under a doctor's care if that's appropriate, and but starting now can help you no matter what age you are. Not smoking, controlling the cardiovascular risk factors like we just spoke about, like high blood pressure and high cholesterol, and all of that. And socialization. Socialization does wonderful things for you. So being social, getting out with people is very, very helpful. We talk more about that in the Cultivating Brain Health video, so take a look at that. And then also education is protective. So if you have a higher degree, that is protective. However, if you don't stress about that, because you can do cognitively stimulating activities. You can have a challenging job or a challenging hobby. Do something that stimulates you cognitively, and that will also be helpful. So again, you can get more of this in the Cultivating Brain Health video. And if you work with folks who are older, think about activities that you could be incorporating that incorporate these principles. And you probably already are doing a lot of them, but hopefully this will give you some more information and some new ideas for what you can do.